Thank you for joining us today as we talk about how you can utilize your HPA to craft a distinctive narrative, presented to you by the Office of Pre-Professional Programs and Advising. In becoming a distinctive applicant, you want to think about where you've spent your time and how these experiences have helped to shape who you are. As you prepare for your health profession school application, whether that is dental, medical, veterinary, um, PA school, any of these health professions programs that you are applying to are trying to figure out who you are and how you have to be prepared for this next step. So that's inclusive of your clinical exposure to healthcare and your healthcare experiences, so your patient interactions and your interactions with healthcare professionals, as well as your thinking, reasoning, discovery, and inquiry. So, how have you challenged yourself in those areas? How have you gained experience through research? Your community service and additional campus experiences. So, community service outside of a clinical setting, how have you served others, and um, what kind of service are you interested in providing, and how do you see yourself providing service through healthcare? Your metrics and academic interests. So this includes the classes, courses that you've taken, your GPA as a result of those courses. That includes the GPA for your science classes, also referred to as your science GPA or your BCPM, and also how you've explored your academic interests. So, have you taken courses that have challenged you, that have changed your perspective? Have you taken courses that are really of interest to you? And then also included in that metrics is the entrance exam or the admissions test that you've taken for this particular for the particular health program that you are interested in. So that may be the MCAT if you're going to med school. It may be the DAT if you're interested in going to dental school. It may be the GRE for other types of health professions programs. But that is also included in your metrics. And all of these come together to really make who you are as an applicant. And the HPA helps you to think about not just what you've done, but why you've done it. So the HPA, which is the Health Professions Application, this is our internal application. And we do have another video on the HPA and the kickoff to the HPA. So if you want more information on what the HPA is, you should also be watching that video as well, which is available on our website. So the HPA is an opportunity for applicants to communicate their values and experiences and their why of medicine and dentistry. Many people, as you start out this journey, it may be your why may be that you really like helping people, and you're also passionate about science, which is a great place to start. But through your experiences, you really are able to demonstrate what your values are and how those values are connected to why you want to go into medicine and dentistry. So you really want to be thinking about your why and how your experiences help to shape that and or define that for you. It's also an opportunity for applicants to exercise communicating their experiences and stories in writing. A large part of your application process will be a reflective journey as you think about your experiences and you communicate those experiences as to how they've helped you to make the decision that this is the path and this is the journey for you. It's also an opportunity for applicants to give context to their distance traveled. In many places on your application, you'll see that you'll have opportunities to be able to communicate what you've done throughout your time in college and beyond. But there's not many places for you to be able to talk about your earlier experiences, and the HPA allows you to do that and will help you to provide or see connections between those early experiences and your current experiences and your decision to now move on to a health profession school. It also gives you a place where you can assess your strengths and communicate evidence of how you have developed them. And this is really an opportunity for you to be able to do this for yourself and really be honest with yourself about your strengths and your ability to be able to communicate that. And also gives us the opportunity to be able to help you with that and guide you through that process. So the components of the HPA are the introduction and application information, also the academic background, which includes a box where you select whether you're so someone to a health professions program and gone through a cycle, whether you are interested in applying to MD, PhD, and a section for those who are interested in dental, as manual dexterity is one of the competencies evaluated in dental that is unique to that specific health professions application. We also have a section where we have you fill out your tentative letters of recommendation. We have you do the tentative letters of recommendation to give you practice and also to help you to figure out who will be best to write your letters of recommendation. This space will allow you to be able to identify who you would like to write for you and then why. What are the qualities or what have they observed or what have you learned in that space that this person can now speak to? And it will help you to decide if you are in a space of who should I ask for a letter of recommendation. It will help, I think, it will provide a space to be able to help you to figure that out. Later on in the HPA, once the first section is submitted, you'll get access to a second section, which will allow you to put in your final list of letters of recommendation. So on the first part of which you are working with the HPA, this is the tentative letters of recommendation, and it really is meant to be an exercise for you. There's also a work and activity section, which mirrors what you will see on your health professions application, as well as short answer essays, a self-assessment, and a place for you to identify your strongest competencies. So in the work and activities section, the goal of it is really to see how you have spent your time. So on the AMCAS application, which many of you may be filling out, submitting for MD programs, there is a max of 15 activities that you can identify on your application. There are some other health professions applications that are unlimited, but the majority of you will be filling out the AMCAS, and so you should operate under the 15 max. The character limits are 700 for the first 12, and then 700 plus 1,325 characters for your 3 most meaningful experiences. Oftentimes we get questions about the most meaningful experiences. What should they be? Should you be strategic about picking your meaningful experiences? And the best advice that I can give you in terms of your meaningful experiences are really to select those that represent something, that represent an experience that really has taught you something and that you really feel like you have grown from. Either, and really any of the competencies. So whether that's your teamwork, your communication, your skills that you've learned, your empathy, your compassion. I do think that there are certain experiences that are essential to have when you are going into a health professions application, and it does make sense that those experiences are part of your most meaningful experiences. For example, it may be a clinical experience or a research experience that you've had. But when you're deciding on what your 3 most meaningful experiences are, they really should be what has been most meaningful to you in this journey and helping you to really grow and decide to continue on this path. You also want to be clear and concise in paragraph format where you communicate. So your roles and responsibilities, your lessons learned and your skills developed, and your connection to why medicine and dentistry, if applicable, should be included in your description of work and activities. So the connection to why medicine dentistry, where applicable, you don't want to go out of your way to try to make something up or make a connection that does not exist. But that does not mean that the activity that you've listed is any less important to how you've spent your time. So these are the types of experiences that you will be able to designate on your application. So community service volunteer, medical or clinical, community service volunteer, not medical or clinical. And I just want to highlight those two because we often get questions about that, about community service, and if it's different than your clinical experience, even if you were volunteering in a clinical experience. And yes, it is. Clinical experience is very valuable and is a necessity in your application as you plan to go into a clinically related field in a health profession school. Community service, not medical, really showcases your commitment to the communities that you're in outside of the medical space. And as you do enter into the medical space, however you choose to do so, you will be a person who serves your patients. And so you really do want to think about your commitment to service and who you are as someone who serves their community. So then there's also physician shadowing and clinical observation, which is different than your clinical experience, as the clinical experience is a bit more direct and hands-on, and shadowing tends to be a bit more passive in nature as it is an observation. You also can designate paid employment, medical, clinical, paid employment, not medical, clinical, and a host of other things that you can see here that you can designate your activities and types of experiences. So some questions to think about as you are completing your descriptions. What was your role responsibilities? Is that clearly defined in your description? Why did you choose this experience? Was it something that you were trying out and you wanted to gain more experience in that area, or it was something that you were curious about? Is it something that you were already passionate about? And so you wanted to continue on in this experience or find new experiences in that area? Whatever it is that led you to that, you want to make sure that you are able to communicate that. How did you contribute to this experience? So what, in addition to, or rather expanding on your roles and responsibilities, what have been your contributions to this particular experience? And what did you learn? What did you take away from that experience? How have you grown? Did it challenge you? Did your perspective change? Were there new insights that you made as a result of this experience? So some tips for your work and activity section. You want to keep your core competencies in mind and make sure that you are showing how you've done something. And we'll have an example a little bit in just a bit about how to show how you're doing something. Make sure you have experiential evidence of your why medicine. So it's not enough to just communicate that you really want to be a physician and that you really see medicine as your calling. You want to use the experiences that you've had to be able to back up that with essentially evidence that you've exposed yourself to this field and that you remain committed to it. Use active verbs to express action, not only listing responsibilities. So, for example, I kept a running journal for the lab experiments versus I meticulously kept a running journal by recording daily notes of the lab experiments, right? So that shows us how you did that, and we can have a better understanding of who you are in the lab. Narrative writing is great, but it's not fitting for all descriptions and it is not required. So narrative writing, falls along the lines of storytelling writing, and it's fine if that lends itself to what you are describing, if it's an experience with a person or if it's a meaningful experience and you're expanding on that and you want to give some background with a inclusive of a story. But oftentimes we get questions about whether or not that's a better approach. And the honest answer to that is that it really is dependent upon your experience and also you as a writer. You can effectively communicate what you've done in paragraph format without having to go into narrative writing and do more descriptive or declarative writing. Don't leave out your non-medically relevant experiences, your hobbies, your extracurriculars, employment outside of clinical spaces are all valuable to your experience. And you really want to think about quality over quantity. It's not important to be able to fill all 15 spaces just to fill the 15 spaces. You want to make sure that you are utilizing the space to really be able to communicate how you've spent your time up to this point. So think about the things that have been meaningful to you, the things that you have interest in, the things that you care about, and those should be the activities that you include. If that only adds up to 12, that's absolutely fine, and there's no need to try to find 3 more just to fill in 3 spaces. So here are the double AMC core competencies. And although the double AMC is the governing body for medical schools, the core competencies also apply to really any health professions program that you are looking to apply into. So you can go ahead and take your phone and scan that QR code, and that will lead you to the double AMC core competencies. But these are the things that you should have in mind as you're completing your HPA, your work and activities description in particular. So the next section that you'll see are the goals, are the essays. And the goal of the essays are really to communicate who are you and what motivates you. So in that first question, where we ask about your background, it really is to give context to your journey at any point in time. So background, identities, influences, your life events, and people from birth to present day. You want to consider your values and beliefs and how they guide your decisions or continue to guide your decisions to pursue a career in medicine, dentistry, and other health professions programs. We ask you to do this because I mentioned earlier that you really won't have the opportunity in many spaces on your primary applications to health profession schools to be able to talk about your experiences before college. But the HPA allows you to be able to do that. And as we utilize information from your HPA for your committee letter, it gives us the space to be able to provide that context for you where you may not be able to do in other spaces. The second question um, really focuses on what and who has shaped your understanding of medicine and how you have developed a sense of serving others. So what experiences have shaped your interest in a career in medicine? And then the third question is an optional section for you to communicate information you think is helpful for us to know, but you don't want communicated in your committee letter. So I think this optional section is truly optional. And some people may have personal things that will help to provide context to their experience, but that they would rather not communicate have us communicate to medical schools and other health professions programs through the committee letter. If you have questions about that, personally, you are more than welcome to always reach out to our office or schedule an appointment advisor. Please, and that is not that you do not have to have something that you do not want us to communicate to the health professions programs in your committee letter. So the next essay that you will see is a focus topic essay, and it really is the goal of that is to understand what is important to you about your journey. So you'll have the opportunity to select a focus topic, It could be leadership, academic interests, your contributions to your community. It can be overcoming a challenge. And from these choices provided, you will focus on an area you believe is core to your distance traveled. So to your journey, your personal journey. What are the experiences that you have had that have really shaped you under these focus topic areas? So, experiences at any point in your educational journey that you perceive as important for admissions to consider when assessing you should be included. And it may be connected to your why and how you see yourself in healthcare and medicine. And then there is a section on academics and additional info sections where you can give context to any academic or personal challenges that would be helpful to understanding difficult situations that need to be or should be addressed. So sometimes people will use this space if they had a particularly difficult semester, whether that was academically or as a result of personal challenges. And I think the main thing here is to really emphasize what you've learned or how you've grown. If you faced academic struggles, if you during a semester, what resources or how did you learn? What did you learn about yourself or how to approach your next semester that really, if you're faced with that situation again, you know the tools and resources that you can utilize to help yourself in that moment. There's also a place where you can provide a summary, and this is an opportunity for you to really reiterate, highlight, and or underscore any areas of your application that you would like to be emphasized. And this may align with impactful experience section, which is located in the primary application. So this will be the actual application that you submit to your health professions schools. So some tips on the essay section. Keep your why medicine in mind when writing your focus essay. They may be connected. You want to make sure you communicate how you've grown and learned from less ideal circumstances and situations. So we all have challenges. We all have things that we face. And the most important thing in communicating those to others is really what we've learned from that. How even negative experiences are very valuable to our growth. So you want to think about what you've learned from those less than ideal circumstances and situations that you face. Try to communicate challenges in a straightforward, matter of fact manner and reduce more of the quote unquote sob story approach, which really means focusing more on the solution and what you've learned as opposed to what the situation was. So you can simply state that I faced academic challenges in my chemistry course. And this really prompted me to do X, Y, and Z. So you can simply state the matter, pretty matter of fact, and be straightforward about it and really focus on you and your growth and what you've done to overcome it. Look for some of the overlap that you may think about in terms of like your letters of recommendation as the references that you have that you're going to be asking for. So these letters of evaluation. You probably have some idea of what your letter writer will talk about. Like if they're a professor, they're going to talk about you and their observations of you as a student. If it's your PI, they're going to speak about you as a researcher in the lab. So in thinking about what other people may say about you, that can also help you to think about how you may perceive yourself as well in those spaces. Don't expect that we'll make all of the connections for you. If there are things that you see connected in your life that you want to make sure that we see, please do make those connections for us. There's also an opportunity in the HPA for you to do a self-assessment, and some of the goals and tips of that. Because the goal of the self-assessment rather is to understand how have you demonstrated your motivations and passions for your indicated health profession. And so this is an opportunity for you to really be honest with yourself and to get a good understanding of where you are and what you'll be communicating in your application. So how much have you demonstrated versus how much you still need to develop in the following areas of community service, clinical and medically relevant experiences, your research, and your academics? You may have heard this before, but you need to provide receipts. And essentially, your experiences are that. It's not enough to just say that you really want to be in medicine. You want to be able to demonstrate through your experiences that you are really ready for this next step. So link back to your work and activities, but don't copy and paste your descriptions in these areas, but do use them for reference. And you really want to show, not tell, giving details on actions and processes. So here's an example of that. And we're going to give you an example of that with the next section, which is identifying those competencies. So thinking about where your strengths lie. So after choosing a competency and strength, you will explain how you demonstrated that chosen competency through active examples. So this example here, I think, really shows how you can expand on the things that you're doing, and still be concise in that communication while showing the process. So the example here, I was a tutor, volunteer with kids who have learning disabilities, and communicating with patients and research. We can see here all of the things that this person did and the populations that they've worked with. However, these the next example of those same activities, I think, gives a way more robust picture of this person in working in these different spaces. So as early as I can remember, I've loved teaching. At 6, I taught my 4-year-old brother how to write in cursive. I have held a variety of teaching positions, working with children as young as second grade and as advanced college students. Teaching at its core relies on effective communication, and I've learned to be effective in a variety of tricky situations, redesigning lesson plans to be virtual, catering to different learning styles, and even working with kids with learning disabilities. In my current job, I utilize similar strategies when obtaining informed consent from research patients to ensure that they fully understand all aspects of the study before agreeing to participate. So this person was able to communicate their love of teaching, what they've learned from that, the populations that they've worked with, different things that they've done to demonstrate their communication skills, and also how they utilize the skills that they have through teaching in different spaces. So they're highlighting their transferable skills as well. So the HPA, and in review of it, the review of your activities, experiences, your focus on a clear why in medicine and dentistry and other health professions, assessing your HPA for themes, identifying your competencies developed and strengths, and review of your essay prompts in the HPA can all help you to then develop your personal statement. And your personal statement is a short writing piece that really does encompass your past personal experiences, your academic curiosities, your collegiate experiences, and your personal identity and impactful experiences that go into answering that question of why medicine. And you can utilize the HPA in writing your personal statement by reviewing what you've written and what you've done. So utilize your HPA to help write your personal statement and to prepare for your primary application. Some of the upcoming some of the upcoming support that we have for you all as you go through this process, we will have HPA drop-ins during the month of March. For everyone in the application cycle, so you can come with your questions. These are open drop-ins, so everyone will be able to hear from one another. And I think that these types of drop-ins not only help you answer questions on HPA, but with your personal statement as well as other pieces of the application. And we'll also have a personal statement workshop on March 4th. So please be sure to join us for that. In the meantime, if you have any questions, you are always welcome to reach out to the Office of Pre-Professional Programs and Advising. The email address is provided here, as well as the many resources that we have available on our website. And if you're not already, please do follow us on social media. We post a lot of great things and helpful information. So I hope that this has helped you to better understand how you can utilize the HPA throughout your entire application process. Good luck.